Right now, before you do anything else, I want you to lay both of your hands flat on the surface in front of you. Spread your fingers. Look at your nails in the clearest light you have, natural light if you can, and really look at them. Not a glance. A deliberate look. Notice the color, the shape, whether any ridges run across them horizontally, whether the white part at the base looks larger than usual or smaller, or whether the nail itself has taken on a yellowish tone you have been blaming on dish soap or last summer's garden work. Here is what almost no one has ever told you. Your nails are not cosmetic. They are diagnostic. Every nail on your hand is a thin slice of biological archive, a record written in keratin that reflects what has been happening inside your body for the past 3 to 6 months. The changes happening in your liver, your heart, your lungs, and your circulatory system right now are being quietly written onto the surface of your nails, in a language you were simply never taught to read. The conditions that show up in your nails, liver disease, severe iron deficiency, lymphatic dysfunction, uncontrolled diabetes, and even bacterial infections of your heart valves, are not rare. In adults over 60, the vast majority go undetected not because they are invisible, but because we have been trained to dismiss changes in our nails as just getting older. After today, you will not be able to unsee what I am about to show you. I am a neurologist with over 2 decades of clinical practice, and I have made it part of my mission to translate what medicine knows about the aging body into information that belongs with you, not locked behind a consultation you have to schedule 3 weeks in advance. We are going to walk through 5 nail findings today. I want you to know right now that I have saved the 5th sign for last, deliberately. It is the one most commonly mistaken for a minor bruise, the one most likely to be waved off at a routine checkup, and it is the one most likely to be connected to something that requires urgent attention. Do not skip ahead. Context matters. Before we get into the specific signs, I need to give you a short biology lesson, because once you understand how your nails are formed, the logic of what I am about to tell you becomes obvious, and you will never forget it. Think of your nails the way a geologist thinks about rock strata. When a geologist looks at layers of sediment in a cliff face, they can tell you what was happening on Earth thousands of years ago, all from the physical record laid down in stone. Your nails work the same way. They grow from a structure called the nail matrix, a crescent of tissue tucked just beneath the skin at the base of your nail. Everything that flows through your bloodstream passes through that matrix. And everything that disrupts that blood flow, changes that chemistry, or inflames the vessels feeding that tissue gets written into the nail as it grows outward. Nails grow approximately 3 to 4 millimeters per month. That means the nail you are looking at right now contains roughly 3 to 6 months of biological history. A disruption that happened 4 months ago, a period of severe illness, a cardiac event, a dramatic drop in iron or protein, may be sitting there on your nail, visible right now if you know what to look for. I want to be clear about something important. Your doctor is not at fault for not catching these signs. A standard primary care appointment runs 12 minutes on average. Nail examination is not part of a routine physical protocol. These signs are not secret or suppressed. They are simply not prioritized in a system optimized for volume. That is why you need to know them yourself. This matters especially if you are over 60. Many of the internal conditions that express themselves on the nail, liver stress, anemia, lymphatic dysfunction, vascular inflammation, accelerate significantly in the 6th decade of life and beyond. Please remember throughout what I share today, none of this is a diagnosis. These are prompts for conversation with your doctor. Specific, educated prompts that could lead to early detection of something that, caught in time, is very treatable. The first sign is called Terry's nails, named after the physician who first described them in 1954. And what you are looking for is this: a nail that has turned predominantly white or pale across most of its surface, with a narrow band of darker pink or reddish-brown color remaining only at the very tip, spanning roughly the last 2 to 3 millimeters of the nail. All nails have a white crescent at the base. That is normal. What is not normal is when the majority of the nail bed loses its pink tone and turns whitish, while the tip retains that thin, darker strip. The nail should look pink when pressed because blood is flowing through the skin beneath it. When the nail goes white, that blood supply has been displaced. When the liver is under stress from cirrhosis, fatty liver disease, or chronic heart failure, the body accumulates excess fluid, and the connective tissue beneath the nail fills in a way that pushes the tiny blood vessels away from the nail surface. You are not seeing a diseased nail. You are seeing a nail where the blood has been literally displaced by internal swelling you cannot otherwise feel. A patient of mine, 67 years old, a retired school administrator in excellent apparent health, had her daughter notice during a family dinner that her mother's nails looked almost plastic. pale and uniform in a way that seemed off. She had no pain, no jaundice, no fatigue beyond what she attributed to age. When she mentioned it at her next appointment, her physician ordered a liver function panel almost as a formality. Her liver enzymes were significantly elevated. An ultrasound followed. She was in the early stages of non-alcoholic fatty liver disease, a condition affecting an estimated 1 in 4 adults over 60, almost always silently. Because it was caught at this stage, dietary changes and monitoring were sufficient. Without that nail observation, the next sign would likely have been fluid accumulation in the abdomen, by which time the liver damage is substantially harder to reverse. In natural light, lay your hands flat and look at the nail beds, the skin showing through the nail, not the nail edge. If the majority of 2 or more nails looks pale, whitish, or opaque, photograph both hands side by side. Do this weekly for 2 weeks. If the appearance is consistent and not explained by cold temperature, bring the photographs to your doctor and ask specifically for a liver function panel and a complete metabolic panel. The second sign has a name that sounds almost decorative, koilonychia, but what it describes is anything but. In plain English, it means your nails have developed a concave, scooped-out shape. Instead of curving gently downward over your fingertip as a normal nail does, the nail has flattened and then curved upward at the edges, like a tiny spoon or a shallow bowl sitting on your finger. To test for this right now, take a small drop of water and place it on the surface of your nail. If the nail is healthy and normally curved, the water will roll off immediately. If your nail is developing koilonychia, the water will pool and sit in the center. That is how concave the surface has become. The connection here is iron. Koilonychia is one of the most reliable clinical indicators of severe iron deficiency anemia. Not mild low iron, but iron stores so depleted that the body is pulling resources away from peripheral structures like nails. When iron is chronically low, the nail matrix does not receive enough oxygenated blood to build a strong, normally shaped nail. The structural proteins organize incorrectly. The nail softens and distorts. Think of it this way. A well-fed nail grows like a firm arched tile. An iron-starved nail grows the way bread dough would if the yeast failed, flat, without the structural tension to hold its shape. Importantly, koilonychia in older adults can also signal hemochromatosis, the opposite condition, where the body absorbs too much iron and deposits it in organs including the liver, heart, and pancreas. This is why self-interpretation is dangerous. The nail sign is the same, the underlying condition can be the opposite. Your doctor needs a serum ferritin level and a full iron panel to tell the difference. A 71-year-old retired engineer came in for a knee issue and mentioned, almost apologetically, that his nails had gone strange over the past year. He had some shortness of breath climbing stairs and had attributed all of it to being 71. His nails on 3 fingers showed unmistakable koilonychia. His ferritin came back at 6. A normal level is between 30 and 300. His hemoglobin was critically low. A colonoscopy revealed a slow-bleeding polyp, the source of his chronic blood loss. It was removed. His iron normalized over 6 months. That polyp, had it continued undetected, carried a meaningful risk of malignant progression. Perform the water drop test on your index finger. Then look at your nails from the side. Hold your finger at eye level and look at the profile. A healthy nail domes gently. Flat or upward curling is the sign. If you observe this on 2 or more fingers, ask your doctor for serum ferritin, serum iron, TIBC, total iron binding capacity, and a complete blood count. Use those words. I have noticed spoon-shaped nails and I would like my iron levels checked. The third sign is one that many people have already noticed and explained away: yellowing of the nails. Mild yellowing is often genuinely harmless. Nail polish staining, fungal infection, nicotine. But yellow nail syndrome, the clinical condition, is something different. In yellow nail syndrome, the nails turn a pale to deep yellow or yellowish green across the entire surface. But the color is not the only change. The nail also slows its growth dramatically, sometimes almost stopping. It becomes thickened and excessively curved from side to side. The cuticle disappears or detaches. And critically, the nail may partially separate from the nail bed starting at the tip. Nail fungus yellows from the tip and causes crumbling beneath the nail. Yellow nail syndrome produces a smooth, thick, uniformly discolored nail with a slow growth pattern and an absent cuticle. This happens because of impaired lymphatic drainage. When lymphatic vessels are compromised, fluid accumulates in the tissue surrounding the nail matrix. The resulting chronic low-grade swelling impairs nail growth and alters the nail's structure. Think of your lymphatic system as the drainage network in a city. When the drains are slow or blocked, fluid pools, things stagnate, and the environment changes chemically. Your nail is sitting in that changed environment. The conditions associated with yellow nail syndrome include lymphedema, respiratory conditions such as bronchiectasis and pleural effusion, and in adults over 60 particularly, it can be an early marker of diabetes or an internal malignancy affecting the lymphatic system. A 63-year-old yoga instructor noticed her nails had turned yellow-green and stopped growing noticeably for several months. She had also been treated twice in 2 years for chest infections that cleared slowly. A chest X-ray, ordered after her physician observed the nail signs, revealed a collection of fluid around her lung. Further workup identified an early-stage lymphoma. Treatment began immediately. Her oncologist later told her that the window for curative intent therapy would have narrowed considerably with another year's delay. Compare your nail growth now to 3 months ago. If you have a photograph of your hands from a few months back, compare them side by side. Look for slowed growth, thickening, uniform yellowing, and disappearing cuticles. If at least 3 of those features are present on multiple nails, ask your doctor for a chest X-ray, a lymphatic assessment, and a fasting glucose test. The 4th sign is one you can feel before you can see it. Run your thumb along the surface of your index fingernail from base to tip. Does it feel perfectly smooth? Or do you feel a ridge, a horizontal groove running across the nail from one side to the other, like a faint speed bump in the nail's surface? These grooves are called Beau's lines, named after the French physician who described them in 1846, and they are literally the record of a moment when your body stopped producing your nail. Not slowed. Stopped. When the nail matrix shuts down nail production, even temporarily, the nail that grows before and after the pause meets at a groove. That groove is Beau's line. You are holding the scar of a systemic insult in the palm of your hand. Very fine ridges running from base to tip, lengthwise, are normal with aging. We are looking for horizontal grooves that cross the nail from left edge to right edge. Multiple horizontal grooves on multiple fingers simultaneously is the systemic signal. Because nails grow at a known rate, you can actually estimate when the disruption happened. If the groove sits 5 millimeters from the base, it occurred roughly 6 to 8 weeks ago. If it sits near the middle, it occurred 3 to 4 months back. You are dating an event? What causes the nail matrix to shut down? Severe systemic illness, high fever, major surgery, significant nutritional deficiency, uncontrolled diabetes, one of the most common causes in adults over 60, because the vascular damage from persistently high blood glucose impairs blood flow to the nail matrix. Cardiac events that went unrecognized, chemotherapy, severe zinc deficiency. A 68-year-old patient came to me for hand numbness. During the examination, I noted 2 parallel horizontal grooves on all 8 of his fingers at the same position on each nail. He had no memory of a major illness. When we discussed timing, approximately 4 months prior, he recalled a terrible flu with a fever of 104 that lasted 5 days, during which he had barely eaten. His blood glucose was significantly elevated. He had undiagnosed type 2 diabetes. The flu had likely been a hyperglycemic episode. The Beau's lines had quietly recorded it. We caught the diabetes. His cardiovascular assessment identified early arterial stiffness, treatable at that stage. Using a thumbnail, run gently across the surface of each fingernail. Photograph them in raking light, light coming from the side rather than above, which makes surface texture visible. If you find horizontal grooves on 3 or more fingers, bring this to your doctor. Request a fasting glucose, HbA1c, the 3-month blood sugar average, a complete blood count, and a zinc level. I told you at the beginning that I saved the most important sign for last. This is it. Look very closely at your nails right now, as close as you need to see clearly. You are looking for tiny dark lines running vertically, top to bottom, beneath the nail surface. They look like thin splinters of brown or reddish-black wood caught under your nail. They are most often found near the tip and are typically between 1 and 3 millimeters long. They are easy to miss. They are easier still to dismiss. These are called splinter hemorrhages, and most people who have them assume they bumped their finger at some point. And sometimes, that is exactly what happened. Trauma to a single nail can cause 1 or 2 splinter hemorrhages in that nail. That is normal. Here is the distinction that could save your life. Traumatic splinter hemorrhages appear in 1 or 2 nails near the tip after a known injury, and they fade over 2 to 3 weeks. Non-traumatic splinter hemorrhages appear in multiple nails simultaneously, often closer to the base of the nail with no known trauma, and they do not correlate with any injury you remember. That is the signal. These tiny dark lines are, in medical terms, microscopic bleeds from capillaries in the nail bed. In a traumatic context, the cause is mechanical. In a non-traumatic context, they indicate that something is damaging the small blood vessels systemically, from inside your circulation. The conditions that cause non-traumatic splinter hemorrhages include vasculitis, inflammation of blood vessels throughout the body, antiphospholipid syndrome, a clotting disorder, and most critically, infective endocarditis. Endocarditis is a bacterial infection of the inner lining of the heart, most often affecting the heart valves. As bacterial colonies on the valves shed tiny clumps into the bloodstream, these microscopic clots travel to the smallest vessels in the body, including those beneath your nails, and rupture them. The splinter hemorrhages you see on your nail may be the surface expression of a process happening simultaneously in your kidneys, your brain, and your retinas. Infective endocarditis is fatal if untreated. Its early symptoms, low-grade fever, fatigue, night sweats, joint aches, are indistinguishable from a dozen common conditions. The window for successful antibiotic treatment is measured in weeks. The splinter hemorrhage can be the earliest external clue. A 72-year-old retired engineer with a replaced aortic heart valve, a known risk factor for endocarditis, came in complaining of persistent fatigue and night chills. His wife mentioned she had noticed dark lines under several of his nails for 2 weeks. His temperature that afternoon was barely elevated. Blood cultures drawn that day grew a bacterial infection. He was admitted and treated with 6 weeks of intravenous antibiotics, and he recovered fully. His cardiologist told him plainly, had he waited another 3 to 4 weeks, the infection would likely have required emergency valve surgery, and his risk of embolic stroke was rising daily. His wife's observation of his nails was the turning point. Use your phone camera to zoom in on your nails in natural light. Look for any dark vertical lines beneath the nail surface. Examine all 10 nails. If you see them on more than 2 nails with no known injury, photograph them immediately and contact your doctor today, not at your next routine appointment. Today. Ask specifically to rule out endocarditis and vasculitis. If you have a prosthetic heart valve, a history of rheumatic fever, or a recent dental or surgical procedure, make that the first thing you say when you call. Now that you know what to look for, here is exactly what to do. Today, take your hands to the best natural light available. Lay them flat on a white surface. Photograph both hands from above and then from the side. Do the water drop test on each index finger. Run your opposite thumb across each nail surface, feeling for horizontal ridges. Note anything asymmetric between your left and right hands. This week, write down what you observe. Date it. Note which nails, which signs, how long the change has been present. Think back. Did anything happen 3 to 5 months ago? A period of illness, a hospital stay, a time when you barely ate, a surgical procedure? The timing may tell you something. Within 30 days, schedule a visit with your primary care physician. Request these tests by name: complete blood count, comprehensive metabolic panel, liver function tests, serum ferritin and iron panel, HbA1c, fasting glucose, and serum zinc. If you observed splinter hemorrhages on multiple nails, request blood cultures and an echocardiogram, and do not wait 30 days. Contact your physician this week. At the appointment, say this, or something close to it. I have been learning about nail signs that can reflect internal health, and I have noticed some changes I would like to document with you. I would like to make sure we have baseline blood work to compare going forward. Can we discuss which test would be appropriate for me? That framing respects your doctor's expertise and opens a conversation rather than demanding a conclusion. Your body has not been hiding things from you. It has been talking to you in a language you were never taught, through channels you were never shown. The changes on your nails are not random. They are not cosmetic noise. They are dispatches from your liver, your heart, your blood, your lymphatic system, the quiet infrastructure that keeps you alive and that rarely gets the attention it deserves until something has already gone wrong. You now know what to look for. 5 signs that most adults never learn to read. 5 signs that, in the right circumstances, can be the earliest visible evidence of something your body has been trying to flag for months. The information I share is not new. It is not alternative medicine. It is the same information physicians learn in training and use in practice. The gap is not knowledge. The gap is access. And information that could prompt early detection of something serious belongs with you, not behind a consultation you have to schedule 3 weeks from now. Before you close this out, think of one person in your life who is over 60, a parent, a sibling, a spouse, a close friend, someone who would never seek this out on their own, but who has been waving off changes in their body for years. Share this with them directly. Not as a forward, not as a link in a group chat. As a personal message, I watched this and thought of you. That is an act of care that costs nothing and could mean everything. Take care of yourself and take care of each other.